October is National Dental Hygiene Month. It's a perfect time to revisit good oral health tips. People with good oral hygiene habits can keep their natural teeth even if they live up to 100 years old. So medical studies link poor oral hygiene to serious health issues, including cardiovascular diseases. So it's not just cavities. Dr. David Persse, Chief Medical Officer for the City of Houston, is joining us now to discuss how dental hygiene can keep diseases at bay. This is something a lot of people don't think about, Dr. Persse.
Yeah, that's right. You know, we think of our teeth and our oral hygiene is just related there, but it can impact many organ systems and cause lots of other problems across the body. So, you know, here in Houston, we know that as we get older, and this goes everywhere, but as we get older, you know, our teeth, you get one set of teeth, right? And so if you don't take great care of them, they're going to, you know, have trouble in later years. We know that here in Houston, for example, for people age 65 and older, nearly 18% of Houstonians have no teeth left at all. And in some of our more medically disadvantaged and underserved areas, it can be as high as 26 or 30%. So it's a real problem for folks in certain situations.
Yeah, absolutely. I mean, so we're going to talk about how Houston fares on dental health issues. Like 18% of people 65 or older.
Yeah, across the board. And as I said, in some of our more medically underserved areas, it can be 26 and up to 30% of people in some of our poor neighborhoods have no teeth left at all when they reach the age of 65.
Yeah, obviously that can present some health challenges, and getting an appropriate diet. I mean, talk about some of the serious conditions that can come up for someone who neglects taking care of their teeth.
You know, so when we think about our poor teeth, we think of the usual sorts of things. It's going to cause some bad breath. It's going to be painful. People won't eat as well. Certainly, hard to eat things, crunchy things like nuts, which are going to be really good for you, become difficult to eat. But we've also seen that people who take really good care of their teeth can have, and good care means you brush at least twice a day for at least 2 minutes each time. And we've seen that those folks who do that, have good oral hygiene, have a greatly reduced risk of heart attack and stroke. And in addition to that, we find that folks who have it also reduces other things as well, but I think that we don't correlate our oral hygiene with our heart and our brain, and so it reduces heart attack and stroke risk, very much so.
Wow. I mean, and I think that going to see a dentist is one of those things that a lot of people say, even if you have health insurance for your employer, you may not have great dental health insurance. First of all, how often are we supposed to be getting to a dentist as an adult?
So as an adult, you should be seeing your dentist at least every 6 months. And when you go to the dentist, they're going to do a really in-depth cleaning of your teeth. So they're going to get in between those places it's difficult for you to get to. They're also going to get off the plaque. That brushing does a pretty good job of getting rid of the plaque, except there's the little nooks and crannies that you can't get into. And this is really important. Again, we talked about, heart disease and stroke, but also there's some evidence that links poor oral hygiene to other really serious diseases like Alzheimer's and diabetes. And
really?
And we found that some pneumonias are from bacteria that come from your mouth. There's also suggestion that cancers can be related to it. And here's one thing that I think, most people don't know, is that for pregnant women, their oral hygiene is really important too. They've actually been able to find mom's oral bacteria in the amniotic fluid of babies at birth. So this bacteria from your mouth can spread anywhere if you don't take care of your teeth really well. And so again, another reason why you need number one, be on top of your own oral hygiene, brush twice a day for at least 2 minutes at a time, and go see a dentist at least every 6 months. Not only will the dentist clean your teeth really well, but if you've got a problem developing, they're going to let you know about it and how to take care of it early before it becomes a big problem.
Yeah, on our screen right now we have some of that advice you're giving: brushing your teeth after meals or at least twice a day, flossing, especially at bedtime, limiting sweets and sodas. It says drink fluoridated tap water, which is in our City of Houston tap water, correct?
That's absolutely right. And it's just a good way to get more fluoride into your teeth. And it's at a very low level. It's a very safe level. But don't ever swallow your toothpaste. That's another thing people need to know, because there's a lot of fluoride in your toothpaste. You don't want to swallow the toothpaste. But drinking the fluoridated water is perfectly safe.
All right. And not smoking, eating healthy, all those things. I mean, the dentist aspect, that's a big barrier for a lot of people to overcome. If they're following all of those things that we just mentioned there, they're probably in pretty good shape. But getting to see a dentist is a big struggle for a lot of people. But you guys have dental care centers at the Houston Health Department, right? Can you talk a little bit about that?
Yeah, sure. So here with the Houston Health Department, we do have a dental safety net for folks, and this is really, it's predominantly, it's funded outside of. You don't have to pay for it. It's funded outside. So it's for people who don't have insurance or otherwise have access to health care. And it's predominantly for children and pregnant women. But you can call, and the number is 832-393-5427. And we will either be able to get you into one of our clinics or maybe give you some advice as to where you can go to get low-cost dental care if you don't qualify for our program.
All right, give us that number one more time because we did not put that on the screen.
Okay. Yeah, it's area code 832-393-5427.
All right, that is very good information to call. I mean, I know anytime that the Texas Dental Society or these organizations get together and have like free days where they help people, they are just inundated with people who want to get in and see a dentist because it's important.
Yeah, and that's good to see because that tells us that those folks recognize the importance of good dental care, and they're, and it may be difficult for them to get it, but they're going after it. I also worry about the folks who don't realize, this is why a segment like this is so important, the people who don't realize how important dental care is, not only to their oral health, but to their whole health. We talked about Alzheimer's and cancer and diabetes and pneumonias and the dangers to your unborn child. So oral health care is really important for your entire health care.
Absolutely. Dr. David Persse, thank you so much with the City of Houston's Health Department. We appreciate your insight every week. Have a great one.
You too. Thank you.